Hello friends, my name is Rishabh and today we are going to discuss fibrous dysplasia. Okay, okay, fibrous. Okay, let's start with this point. Fibrous dysplasia. Okay, in this, bone is replaced by fibrous tissue and secondary metaplastic bone formation occur. In this disease, bone is replaced by fibrous tissue and the secondary metaplastic bone formation occur. And in this, secondary metaplastic bone formation occur. Okay. Okay. Now, GNAS1. GNAS1 is a gene, okay, which get mutated in this disease. So the full form is guanine nucleotide binding protein stimulating active polypeptide. Okay, so this gene get mutated. Normally this gene produce G protein, but after getting mutated, the G protein is encoded in large amount, therefore G protein encode for the cyclic AMP. So the more amount of cyclic AMP is produced. Now due to the more production of cyclic AMP, it changes the normal function of these three things, that is endocrine, melanocyte and osteoblast. Okay, so the endocrine, melanocyte and osteoblast activities have been changed, due to which the disease is occur, and the disease is fibrous dysplasia. Okay, now as you can see, it is written, the mutation of gene cause overproduction of cyclic AMP and result in defective tissue, these three tissues, endocrine, melanocyte and osteoblast. Okay, now come to the clinical feature. Okay, two forms of fibrous dysplasia are there, that is polyosmotic and monoosmotic. Okay, polyosmotic and monoosmotic, and the common age is 3 to 15, 3 से 15 साल. Okay, and the polystotic fibrous dysplasia involve more than one bone. Okay, more than one bone is involved, as you can see in the diagram. The more number of bones are involved, and in the decreasing order it is written. The first one is that it involves most frequently. Okay, for example, the femur is involved most frequently, and less than that tibia is less frequently involved, and further in a decreasing order. So how we can remember this? We will start it from the lower portion of our body, that is femur, and then tibia, then pelvis, then ribs, and then we will go up to skull and facial bone, and then upper extremities. This is the sequence, and then we will go to this side and clavicle and cervical spine. Okay, and these bones are affected. Okay, and few more clinical features are like bone pain, spontaneous fracture of extremities and bowing of long bone. Okay, and other is curvature of femoral neck called Shepherd's crook. Okay, come to the next page. Now pigmented macules in this disease, as we have seen, the three things has affected: endocrine, melanocyte and osteoblast. So as we can see, the osteoblast is affected, therefore the bone deformities have been seen. Now come to the melanocyte deformities, that is pigment. So come to this point. Pigmented macules referred as cafe au lait, and this is the spot, cafe au lait spot. This is the name of the disease. Pigmented macule referred as a cafe au lait spot on midline of the body, lower back and shoulder or neck. Now this is cafe au lait is a disease. Okay, fine. We can remember this as a name of a cafe, and there's a we can also further we will come in contact with this type of disease, that is Jeff's type. We can remember this with a stupid story like cafe au lait is a restaurant and Jeff is a waiter. Okay, Okay, leave this. Come to the second point. Endocrine dysfunction, as we have seen in the previous page, that melanocyte, osteoblast, and endocrine. Now come to the endocrine point. Endocrine dysfunction. For example, precocious puberty, hyperthyroidism, hyperpituitarism, and hypercalcemia. These are the endocrine dysfunctions. Okay, what is thyroid, pituitary, calcium, and precocious puberty? Okay, now come to some of the syndromes associated with fibrous dysplasia. First point is polystotic fibrous dysplasia. So triad of three things, that is bone, endocrine, and pigmentation defects. And if these three defects are present, it is termed as McHugh-Albright syndrome. What? McHugh-Albright syndrome. Okay, come to the next point. When polystotic fibrous dysplasia show only pigmented defect, that is cafe au lait spot, called as Jeffrey's type. Now we can remember and connect both of things like cafe, Jeffrey. Cafe au lait as a restaurant, Jeffrey is a waiter, and when only this spot is present, we call it as Jeffrey type. Now come to the next point. Polystotic fibrous dysplasia with multiple intramuscular myxoma. Okay, this is 3M, multiple intramuscular myxoma. If this is present, we call it another M, that is Mesobrod syndrome. 3M, then another M. Okay, multiple intramuscular myxoma called Mesobrod syndrome. Okay, now come to the next point. That is, in case of, as we have discussed, all these are symptoms of polystotic fibrous dysplasia. Okay, and now come to monostatic fibrous dysplasia. Monostatic fibrous dysplasia include, as we have seen in the previous thing, that polystotic fibrous dysplasia includes so many of bones. In this, it only includes few of the bones like ribs, femur, tibia, okay, craniofacial humor in descending order. Okay, now another feature is if maxilla is affected, the appearance of the face will be like leonine appearance will be there if maxilla is affected. Okay, come to oral manifestation. Okay, oral manifestation, in mouth we can see painless swelling, very important, painless swelling. Okay, and mandible inferior border is affected, displacement of tooth, mucosa will be intact. This is also a feature, mucosa will be in a good condition, and delayed eruption, malpositioning of teeth. All the problems are related to teeth. Okay, another point is fibrous dysplasia of maxilla is serious, and multiple surgeries are required, and the lesions are not well circumscribed, and the lesions of maxilla tends to extend to maxillary and zygomatic and other parts of the face, like zygomatic and floor of orbit, base of skull, etc. Okay, now radiologic feature, there is only a few of the features, like as you can see in the photograph, sclerotic body called Rind sign. The sclerotic border is visible, it is called Rind sign. The border is sclerotic and we call it as Rind sign. Radiolucency, we can observe the radiolucency, and show scalloping. Okay, unilateral, bilateral, and radio opacity spicules called ground glass or orange peel, that is less important. Okay, thank you for listening and discussing fibrous dysplasia. Thank you so much. If you have any query, please comment me in my channel below. Thank you.